briefings, I try to give you the hard truths, but also explain what's going on. And tonight, I'd like to do that. Governor Newsom announced yesterday a new framework for regional stay-at-home orders throughout the state of California. And I know how confusing it can be to track these changes. But there's one simple truth that we know. We've learned how to contain this virus. We just have to do it. The simple truth that we know is that COVID-19 rapidly spreads, and it rapidly spreads as a result of our own behavior. But we also know that we can slow that spread by wearing a mask, by washing our hands, by keeping our distance, by not traveling, by canceling our plans, by empowering ourselves to defeat this enemy and to make sure that we save the lives of those that we love. It's that simple. We are the ones who avert the disaster. It's how we will protect our workers and our families, make sure that a nurse can show up for his next shift, make sure that somebody who's stocking the shelves so that we can eat doesn't get sick at the end of the day. Today, the numbers were stark again and record-setting in a bad way. 8,860 cases, a number I can hardly believe. Just a few weeks ago, it would have been unimaginable. And we're on the verge of 10,000 cases daily with the numbers that we're seeing this week. Getting this virus under control is mission critical for Los Angeles, and I know that we can do this. When our public health officials give us guidance, they're working on the same basic equation. California has more virus cases now than at any point in this pandemic, and we will soon have more cases than we have available hospital beds. We are perilously close to running out of intensive care unit or ICU beds. So let's get to what the state announced. Nothing has changed for LA yet, but what they did announce is that Los Angeles is part of a region that goes from as far north as San Luis Obispo and Inyo counties, all the way down to the Mexican border. And that when the ICU beds that are in Southern California are 85% filled, it will trigger new closures. Now, here in Los Angeles, most of those things are already closed by the county orders that we had. So we won't see a lot change. But if and when that day comes, and by the way, projections show it could come as early as this weekend or early next week, when 85% of Southern California's ICU beds are filled, the state has now mandated that a few other things close. And let me run you through those so you can know what to anticipate, know what you're still allowed to do, and be ready for when it comes. First, personal care, whether it's nail salons, getting a haircut at the barber, or beauty salon, those will close, as will family entertainment centers and cultural destinations, from zoos to aquariums and museums to places like batting cages and mini golf. Those places will close, and those right now are currently open. But to be clear, they are open. The state has not mandated that they close yet. It's only when 85% of the ICU beds are filled. Second, hotels are now not for tourism. They are for essential stays only. And third, there is also a reduction in our essential businesses from 35% capacity to 20% capacity when we hit that threshold. That will mean that people will be paced into our supermarkets, our essential places like pharmacies when that day comes. So to summarize, what did the state do? It said when the Southern California region has 85% of its ICU beds filled, there will be some additional closures. Most of those closures already have occurred here in Los Angeles, but what will change is that you can no longer go to personal care, you can no longer go to family entertainment and cultural destinations, and those essential businesses that are allowed to have 35% will go to 20% capacity. Simple as that. We had more cases this last week than we had in the entire month of October. And each day we're seeing more people in the hospital and our ICU beds. For this reason, as I mentioned, we're likely to pass that threshold that the state has mandated in the next few days of 85% filled. When they go into effect, the state's closures apply to everybody, by the way. Even though Los Angeles County has already begun and started those closures before, it will now wash over all of the Southern California region. Those counties, Imperial, Inyo, Los Angeles, Mono, Orange, Riverside, San Bernardino, San Diego, San Luis Obispo, Santa Barbara, and Ventura will go together. And the state's planned closures and restrictions are very similar to what's already in place, so not a lot will change here. Campgrounds also will remain open, but overnight stays will not be permitted. No one wants to be in these positions. No one wants to see these things close. Those decisions are painful for all of us. And I know so many of you write to me saying, why is the city doing this? Well, I support our public health professionals, and I have since the beginning of this crisis. Remember, cities can't open up, whether it's Los Angeles, Pomona, Santa Clarita, or Long Beach. We can't open up more than what the county allows or the state allows. We are together on these things to make sure that there isn't a variation from one city to the next, nor do we have those authorities except in Pasadena and Long Beach, which have their own health departments. So to review, the simple truths are: stay home whenever you can. Don't share your air. Don't gather with others outside your household in this critical period, and just be smart and stay apart. This is a painful season to go through those things. We all want to be together. It's the holidays. This is a time when we get to take a pause usually and be with our loved ones and our family members. But know that the act of love is to not be with them, is to not go outside of our household, to keep our friends from being part of this spread, and yes, some of them from losing their lives. To remind people, outdoor recreation is very much still open. And I encourage people in this tough time, you remember the beginning of this, take care of your mental health, your spiritual health, whether it's in prayer, whether it's in being able to go out for a walk. And I know that some people also wrote, we have never in the city, by the way, banned walking or bicycling. In fact, the opposite. I encourage you, get out there, keep your space, wear a mask, but go for a walk, go for a bike ride. Make sure you do those things that can help you get through this tough time. Don't just stay indoors. And make sure that if you do have any mental health issues, that you reach out and you tell people about them so that we can all get through this together. And if you know someone who is suffering, check in on them, call them, FaceTime them, make sure they're okay and not isolated so that this isolation does not compound the mental health issues that we have. As we're taking individual action, we're also taking steps to strengthen our public health systems. And so I want to make a couple announcements tonight about that. Last month, we launched the COVID Response Innovations Study, which is a pilot program on rapid testing. It's bringing rapid testing directly to Angelenos to tap into our spirit of ingenuity and innovation and to give us as many tools as possible to hit the curve down quickly. In phase one of this study, you might remember, we started with our firefighters and essential workers who are on the front lines and most vulnerable. And through that work, we learned important lessons about the accuracy of the different tests that are out there and how we can use them to quickly identify where we're seeing spread or outbreak. And tonight I can share that last week we launched phase two, evaluating the use of these rapid tests in the city's San Fernando Valley super site. This phase is specifically looking at people without symptoms, with a specific focus on children between the ages of 5 and 18. We hope this will inform our schools, inform our educators, and inform our young people to see how these tests can help us in the future make sure they can learn. It'll open the door to a range of possibilities, helping us stop transmissions earlier, making life safer for everyone from students to first responders. And if they prove effective with asymptomatic children, they could prove a critical resource for helping open and reopen schools safely. I want to thank our partners in this study, including USC, Curative, our testing partner, the Rockefeller Foundation, and the LA County Department of Public Health, and the Federal Department of Health and Human Services. As our understanding of this virus continues to grow, so does our approach to fighting it. And that's true in new approaches to testing, but it's also true in our strategy around contact tracing. And I want to make an announcement about that tonight. Starting this week, we are joining with the county in a new digital contact tracing program introduced by our healthcare partner, Healthvana. This new initiative sends patients their test results as soon as they're processed by our lab. And if you test positive, what Healthvana now will give you the option of doing is entering the names and the numbers of people you recently came into contact with, so they can instantly and anonymously get a text message letting them know that they may have been exposed to COVID-19 and linking them with resources to immediately get a free test. In the coming weeks, we're going to make it possible for them to also get a free test by mail, so they don't even have to leave their house in order to see what their status is. And remember, as always, when you get a call from a contact tracer in the county, please answer it. Please finish their questionnaire. This is the way that we will make sure that we can quickly control who has COVID-19 and where it's spreading. As we've seen from the start of this pandemic doesn't just threaten lives, it threatens livelihoods. So as we stay focused on measures to protect lives and the public health, we keep seeking ways to help our workers, our businesses, our renters, families hit with devastating force by the economic blow of this crisis. And we didn't need another reminder of how bad things were, but today we got that notice when we got the latest jobs report showing slowing growth in employment, hundreds of thousands of people leaving the labor force altogether, and permanent layoffs on the rise. This affects people across our country, and the talks around a new federal stimulus have to get closed down. We need a package now. I can't say it more clearly to our leaders. Please don't go home for the holidays before you take care of the American people. I'm heartened to see those conversations going. I'm heartened to hear the optimism that Speaker Pelosi mentioned as well. The way that we've heard from the current administration and the incoming administration, the importance of getting something done. And there has to be aid in there for our schools, for our renters, for our public transit systems, and for our state and local governments on the front lines. There are glimmers of hope that something will finally get done in Congress, but we've never had the luxury here in LA of waiting for a cavalry to come. And that's why this week we announced the SERVE initiative, a new initiative that allows the delivery of one-time $800 stipends to thousands of restaurant workers who have faced the new closures of outdoor dining, and many of them have lost hours and jobs. I want to remind everybody about this again because the opening to apply for this starts on Monday at 9 o'clock. It'll be open all of the 5 work days of next week. So Monday through Friday, and it doesn't matter whether you're first or the last person on Friday. It doesn't affect how quickly you'll get a check or whether you'll be picked. It'll be done fairly and randomly. You can go to coronavirus.lacity.org/serve. If you don't have access to the internet, you can also call 311 and we can walk you through it. But even as we deploy these tools to try to save lives, to protect livelihoods, to help families pay the most basic bills, the pandemic still remains on a very, very harmful path. We announced earlier what the infections were, 8,860 of them. Here in the city of Los Angeles, though, it was our highest number ever as well, 3,756. If we stay on this case trajectory, LA is projected to reach 500,000 cases by the year's end. It's 1 out of 20 people here. If things don't change by year's end, the lives lost will surpass 11,000 deaths. That means 3,000 additional deaths in a single month. To put that in perspective, it's a decade of homicides. It is more deaths than we ever could expect in excess of normal causes of death before this pandemic. This is the greatest threat to life in Los Angeles that we have ever faced. And the current levels of infection won't just mean COVID deaths. It means overwhelmed hospitals so that people who have other life-threatening health conditions might not get in or will be competing for those very same beds that COVID-19 patients need. People with strokes and heart attacks and other emergencies unable to get care. That's why the state is using that metric. I know it can sound confusing. Everything isn't always consistent, but by looking at ICU beds, the state is saying, when we're out of those beds, we're going to be in real trouble. And so the triggers come as those beds fill up. And remember how this virus spreads. The CDC defines exposure as contact within 6 feet of someone for 15 minutes or more. There's just too much of that happening in Los Angeles. In fact, the CDC said if you're in a crowded household today, you should consider even wearing masks at home. This is just the CDC advice, but we know how to control this. Please do everything you can to control it. Our transmission rate remains at 1.14, well above 1, meaning that everybody who's infected is infecting more than one more person, which is why cases continue to rise. We need to get that number down below 1. And right now, 2,769 people are hospitalized because of COVID-19, a 4% increase since yesterday. In 3 weeks, our hospitalizations have tripled. In the last week alone, we saw a 42% increase. And as I mentioned before in the previous briefing, at this rate, we'll be out of beds in 2 to 4 weeks. We have 644 patients from COVID-19 in the ICU who are severely sick and who are hanging on right now. This is a major increase since last month, and each day we're seeing these numbers increase. And while our local numbers remain critically important, the state's orders aren't, remember, triggered just by beds in LA. We're now tied to a region where we're facing massive shortages in some of our neighboring counties where they have not only no beds available, but also no staff available as well. COVID cases among healthcare workers are up 71%. Remember when we used to ring the cowbells, stop by the hospitals to thank the workers, yell out of our windows and applaud? Our healthcare workers need us. And I want them to know, and our lab technicians who are in basements turning out our tests, people who are coming in to clean our hospitals, to feed our patients, our doctors, our lab techs, everybody, that we see you. We see you. We know who you are, and we thank you. But let's also bring down COVID for them so that if we or somebody we love lands in a hospital, they're there to help. The county reported today 60 new deaths. We mourn each and every one of those lives with a name and a story and a family and a community that they leave behind. And we sadly expect this number to continue to rise. But massive deaths are not a foregone conclusion. It's in our hands. One critical tool in slowing those deaths is knowing your COVID-19 status. As of this week, we have now tested more than 2.56 million tests at city sites, far north of half of our city's population since the start of this pandemic. And our current positivity rate, remember when it was down to 3 and 4, is now at 14.85% in those testing centers. I committed to you just over a month ago that we'd expand testing capacity, and we've done it. And this coming week, we're going to do it again. We're seeing our tests fill up every single day, and wait times at the same time are down. Capacity is up, and we have the quickest turnaround times anywhere in the country, getting your test results back usually within 24 hours and by 36 hours. Today, we can test nearly 40,000 people a day, including the new sites that we have at San Fernando Park, which is a walk-up site, LAX, and additional mobile units. Tomorrow, mobile teams will be in the following locations: Avalon Boulevard and 103rd, the North Hollywood Metro Station, Baskin Robbins on West Lawson Avenue, LA Christian Center in El Sereno, and Cesar Chavez and Soto in Boyle Heights. If you want to know where any of those mobile testing sites are, the static ones, any of the other places you can get tested, more than 100 places, go to coronavirus.lacity.org/testing or call us at 311. If you think you've been exposed, get a test immediately. And remember, quarantine until you've received a negative result. And remember that test result only captures that day, the moment you took the test. If it comes back positive, remember that you have to isolate for 10 days from the time your symptoms first appeared and stay isolated for at least 24 hours after your last fever. The people that you've come into contact need to quarantine and then get a test at the end of their quarantine. All of these protocols are available at publichealth.lacounty.gov. Amid the constant stream of news, all the numbers that come out at us, it can be too easy to forget what all this is for, why we care about those statistics, why we are making these painful sacrifices. All of it is to preserve human life. The threat of COVID-19 is real. It's never been more dangerous, and the consequences are devastating. Here in our city family, the people that provide the services for this city, the folks who are out there, whether they're librarians or firefighters, people that work doing the most basic services that help our city function. We're feeling that aching emptiness as we mourn one of our own beloved members, Ever Linares, a father, a partner, a peacemaker. Guided by his own early experiences in gangs and violence, Ever devoted his days to making our city a city of angels and a place of peace. It was his mission to show young people across the city the power of faith, of hope, and of love in the face of violence and poverty. Through his organization, the Resilience Agency, Ever led a team of violence interrupters. And to everybody who's doing that work out there right now, in the face of what we see nationwide with new violence and homicides, thank you for having that courage to step between the conflict, to save the lives, to be angels. And Ever was certainly one of them. He was somebody who mobilized people around him to build healthier communities. He connected youth with new opportunities to education and to jobs. For so many who were blessed to know him, he was so much more than a leader. He was a friend who saw the good, who saw the possibility in everyone, who never gave up on anybody he met. He was a partner and a guide on the walk to a better life. One of Ever's friends put it best. He didn't care where you came from. All he cared about was if you needed him, he was there for you. Lost, he'd show you the way. Scared, he'd give you the courage. Pained, he would help you to heal. That was the mission of his work, the meaning of his life. To Andrea, Ever's partner in life, love, and ministry, to their 7 children and grandchildren, our hearts are so heavy with you tonight. We mourn alongside you, we cry with you, and we will work every day to remember Ever's incredible life, to honor his legacy, and to carry forward his life. As we traverse the difficult road ahead, let us call on the memory of Ever Linares, his compassion and his faith, his belief that we were all made in God's image and that we all have a mission to fulfill here on his earth. So let's take care of each other, lift up one another, honor the sanctity of our charge, and let's protect the people in the communities that we love. LA, let's hunker down. Let's cancel our plans. Let's stay safe and stay healthy, and let's stay at home. Love and strength from my family to yours. Thank you. Happy to take questions, and as always, I'll speak in Spanish after.
Thank you. And our first question comes from Claudia Peshuta from KNX News Radio. Please
hey, Claudia. Ahead. How you holding up?
This week, people are already so frustrated. Do you regret how that was handled? My second question is, given
can you repeat that first one? Because
what do you think about the fact that the LA Police Protective League won't even meet with negotiators to talk about possibly foregoing upcoming raises for officers? Thank you.
Sure, Claudia. Good to hear your voice. You cut off at the beginning. Will you tell me what the thing is that you're asking if I regret?
Oh, sorry. I'm having a hard time hearing you. It was the second question you couldn't hear?
The first one.
The first one, that you know that there was a lot of confusion about the order issued this week. If you regret how that was handled. The second question, what do you think about the Protective League not even meeting with negotiators to talk about possibly foregoing upcoming raises?
Sure.
Thank you.
So if you're talking about the city's order, the city order just copies what the county order is. I know it'll shock people, but I think there was just a mistake made by a reporter who said that we were banning walking and biking. We never said that. We never did. We never would. So no, I don't regret it. We always try to align exactly with the county's words. We've done that, except in a couple rare cases throughout this entire pandemic. So we want to make sure there is uniformity, that it says the same thing. And no, I think that was just something that got misreported, and then part of an echo chamber of people saying LA is banning walking, which we never did, never would, never will. In terms of the Police Protective League, they and all unions we have talked to and are talking to and hope to continue talking to. So I know there's been letters put out and people saying, look elsewhere. I'll reiterate the kind of values that I bring forward. First of all, this is not the fault of our city employees. In 2009, I think people could make a more reasonable case that raises maybe were too big. City leaders had given too big raises. Unions had gotten too big raises when we saw the Great Recession. This is not the fault of city workers. I want them to hear that loud and clear. But second, we will have to share. We're mostly a business, an entity, an enterprise that pays people to do things. We don't spend a lot on equipment or on vehicles or things like that. Most of our costs come from our own salaries. And so we have to figure out a way to get through this, but I promise folks it'll be shared. I also said that civilian and sworn, that's what we call, folks who have a badge, police and fire, and then those who aren't, will both be a part of those discussions. And that I will make layoffs the very last option that we have. We have to sometimes think ahead and plan ahead, and it causes everybody to feel terrible, worried. Will I have a job? I was just the newest one hired. By seniority, I'm going to be gone. It is my promise to my people in this city family that we will do everything we can to get the federal assistance that we deserve, to look at every other way forward. But yes, we will continue talking to folks. And just as we did in 2009 to get through things, we'll figure this out together. And I have that confidence with our Police Protective League. I have that confidence with our firefighters. I have that confidence with our non-sworn employees that are part of the coalition, our Engineers and Architects Association, and every single union. And we will lead, as I said at the last briefing, by example, starting with ourselves, of any sacrifices that we have to make. And it is my hope, though, that in the next 2 weeks, we can have at least a sliver of some good news coming from Washington that can avert those layoffs and that can deal with other ways that we can close the budget. Thanks, Claudia. Next question, please.
Thank you. And that comes from Albert Cerna, a journalist at San Francisco University.
Hey, Albert.
Go ahead.
Good evening, Mayor. Thank you for taking the time to talk to us.
You bet.
I wanted to ask 3 questions. First and foremost, regarding the SERV initiative, are there screening measures in place to ensure that the most vulnerable receive relief first, or is it going to be essentially everybody's going to be in the lottery? And then I wanted to ask if there was a plan for rent forgiveness for those unable to pay back rent when the moratorium ends in January. And then finally, I wanted to know if and how your office has worked with the Department of Probation and Department of Public Health to ensure the safety of youth in juvenile detention facilities. Thank you.
Sure. The last one isn't under our jurisdiction. We do work all the time of making sure that we have diversion program. Very proud that in some divisions we've been able to divert as much as 85% of what used to be juvenile arrests, but both of those are squarely under the county, so not under our jurisdiction. For rent forgiveness, obviously the city can't forgive the rent, but it is something that I'm in favor of, to be able to have federal legislation and state and federal assistance to essentially what some people call cancel rent or cancel mortgages, but to help our mom and pop owners and renters to be able to figure out a way to either pay off over time or even have forgiveness of some of their rent, as long as it doesn't come at the expense of mom and pop landlords losing their investment, losing in many cases their only livelihood, and it becoming corporatized. Today, with the mayor of Miami, Francis Suarez, we did a kind of announcement. There's a CNN op-ed that we wrote, too, building on what we're seeing in other cities. Muy buenas noches, Los Ángeles. Ayer, el gobernador Newsom anunció nuevas órdenes regionales para el estado de California. Sé que todos estos protocolos de salud pueden ser confusos. Lo más importante que necesita saber es COVID-19 está infectando a demasiada gente y amenazando demasiadas vidas. Y necesitamos actuar con urgencia para parar su propagación. La forma de lograrlo es quedarse en casa. California tiene más casos ahora que jamás hemos tenido y estamos cerca de quedarnos sin camas en la unidad de cuidados intensivos. Una vez que el sur de California supere el 85% de estas camas de nuestras unidades de cuidados intensivos, las órdenes del Estado entrarán en vigor. Tuvimos más casos esta última semana que en todo el mes de octubre. Lo más probable es que pasemos esta marca en los próximos días. Cuando llegamos a ese punto, esto es lo que cambiará. Los peluquerías, barberos, lugares de cuidado personal y centros de entrenamiento cerrarán. Y ya no se permitirá hacer camping por la noche. Los negocios minoristas, mercados y centros comerciales se limitarán a una capacidad del 20%. Y las oficinas y los hoteles podrán abrir solo para operaciones críticas y solo cuando el trabajo a distancia no es posible. Todos podemos ayudar a nuestros negocios y en la recuperación de nuestra economía con reducir las infecciones aquí en Los Ángeles. Quédese en casa lo más que pueda y no se reúna con otras fuera de su casa, por favor. También estamos fortaleciendo nuestros sistemas de salud pública. El mes pasado lanzamos un estudio para brindar las pruebas rápidas de COVID directamente a los angelinos. Esta semana lanzamos la segunda fase para evaluar el uso de estas pruebas en niños sin síntomas en el sitio en el Valle de San Fernando. Si vemos logros con niños asintomáticos, estas pruebas pueden ayudarnos a reabrir las escuelas. Además, empezando esta semana, juntos con el condado y Healthvana, empezamos un programa piloto de rastreo de contactos digitales. Si obtiene un resultado positivo, Healthvana le enviará un mensaje de forma anónima a las personas con las que haya estado en contacto, avisando que pueden haber sido expuestos a COVID-19. Como hemos visto desde el principio, esta pandemia ha amenazado tanto las vidas como los medios de vida. Y necesitamos de ayuda federal para nuestras empresas y negocios locales. Este es crítico y espero que nuestros líderes en Washington trabajarán muy duro antes de las fiestas a regresar a sus hogares con la ayuda para la gente de los Estados Unidos. Hoy le envié una carta a los senadores liderando el cargo sobre el esfuerzo bipartidista para el alivio del coronavirus. Mientras esperamos que tomen acción en Washington, tomamos acción aquí. Esta semana anunciamos SERVE, un nuevo programa que le dará $800 a miles de trabajadores de restaurantes. Las aplicaciones se abren este lunes a las 9 de la mañana, permanecerán abiertas durante 5 días, hasta viernes. Para más información, visite nuestro sitio de internet coronavirus.lacity.org/serve, SERVE. Los datos de hoy nos muestran que la pandemia sigue en un camino peligroso aquí en Los Ángeles. En nuestro condado tuvimos un nuevo récord, 8,860 nuevas infecciones. Estas noticias son muy malas. Entre ellos, 3,756 están en la ciudad de Los Ángeles. Si nos mantenemos en esta trayectoria, se proyecta que Los Ángeles alcanzará 500,000 de casos totales de COVID-19 para finales de año. Y si las cosas no cambian, para finales de año podemos llegar a perder un total de 11,401 vidas en el condado de Los Ángeles. La tasa de transmisión ha bajado un poco desde la semana pasada y ahora es 1.14. Necesitamos bajar ese número por debajo de 1. Y en nuestros hospitales, un nuevo récord, desafortunadamente, 2,769 personas están hospitalizadas por COVID-19. En el condado hay 433 camas disponibles. En 3 semanas, nuestras hospitalizaciones se han duplicado. A este ritmo, nos quedaremos sin camas en los hospitales de Los Ángeles en los próximos 2 a 4 semanas. El condado reportó 60 nuevas muertes de miembros de nuestras familias hoy. Pero esta cifra es un indicador de retraso. Tristemente esperamos que las muertes aumentarán dramáticamente. Saber si es positivo o negativo con COVID es una parte esencial de protegerse y a otros. Hemos hecho 2.56 millones de pruebas en los sitios de prueba de la ciudad desde el comienzo de esta pandemia. Y gracias a todos los trabajadores, los bomberos, voluntarios que son parte de este sistema, que han dado pruebas a más de 50% de nuestra población. Mañana tenemos equipos de pruebas móviles en Avalon Boulevard y la calle 103, las estaciones de metro de North Hollywood, Baskin Robbins en la avenida West Slauson y la iglesia LA Christian. Si piensa que ha sido expuesto, hágase la prueba pronto y espere un resultado negativo. Si sale positivo, quédese en cuarentena durante por lo menos 10 días. Para entender los protocolos de cuarentena, mejor visite la página publichealth.lacounty.gov. Les recuerdo otra vez que la razón por la cual estamos haciendo estos sacrificios es para proteger la vida. Hoy lloramos por el fallecimiento de Ever Linares, padre, esposo, pareja y pacificador, quien se dedicó a empoderar a los jóvenes con esperanza y amor a través de su organización Resilience Agency. Lloramos con su familia y haremos el esfuerzo todos los días de continuar su legado. Cuidémonos en uno al otro y a las personas y las comunidades que amamos. Cancele sus planes y manténganse seguro y sano y quédense en casa. Fuerza y amor, Los Ángeles. Ten un buen fin de semana. Good night.